You woke up this morning feeling like you'd been hit by a truck. Maybe your neck hurts. Maybe your lower back is stiff. Maybe your arm is completely numb and you have no idea how long it's been like that. You got your 7, 8 hours, technically, and yet here you are, dragging yourself through the day on caffeine and willpower. Here's the thing. The problem might not be how long you slept. It might be how you slept. The position your body is in for those 7 or 8 hours is doing something to your spine, your airway, your lymphatic system, and even how well your brain is actually cleaning itself overnight. And almost nobody talks about this. So today, we're going to break down every major sleep position: back, side, stomach, fetal, the actual science behind what each one does to your body. And by the end of this video, you're going to know exactly which position is working for you and which one is silently destroying your sleep quality without you even realizing it. Let's get into it. Back sleeping, the gold standard. All right, let's start with the position that sleep scientists consistently rank highest: sleeping on your back, also called the supine position. Look, if you're a back sleeper, congratulations. You're in a minority that's doing something right. Only about 8% of people naturally sleep on their backs, and the benefits are genuinely impressive. When you lie flat on your back, your spine is in its most neutral, decompressed position. There's no lateral twisting, no weird angles putting pressure on your lumbar vertebra. Your head, neck, and spine form a straight line. For people with chronic lower back pain, this is often the single most impactful change they can make. Not stretching, not medication, not an expensive mattress, just the position. A 2019 study in the Journal of Physical Therapy Science found that back sleeping significantly reduced lumbar muscle strain compared to side and prone stomach positions, particularly during the early stages of non-REM sleep, when the body's doing its primary tissue repair. Back sleeping also keeps your face off the pillow, which means less facial compression over time, fewer sleep wrinkles, and less potential for acne breakouts caused by fabric pressing against your skin for hours. I know that sounds like a vanity thing, but it's actually a sign of how much mechanical pressure your face is absorbing if you're a side or stomach sleeper. This is where it gets really interesting, though. That glymphatic brain cleaning process I mentioned? A landmark study in the Journal of Neuroscience found that the lateral, meaning side, sleeping position is actually superior to back sleeping for glymphatic clearance in rodent models. But, and this is a big but, back sleeping wins on almost every other structural metric. The research is still evolving. The takeaway is that no single position is perfect, but back sleeping is as close to the gold standard as we currently have for spinal health. One major caveat, though: if you snore, or worse, if you have sleep apnea, back sleeping can make things significantly worse. When you're on your back, gravity pulls your tongue and soft palate toward the back of your throat, narrowing your airway. The American Academy of Sleep Medicine reports that positional sleep apnea, where symptoms are substantially worse when lying on your back, affects approximately 56% of people diagnosed with obstructive sleep apnea. For those individuals, back sleeping isn't the gold standard. It's actively harmful. Side sleeping. This is where most of you live. Roughly 60 to 70% of adults prefer some form of side sleeping, either curled up in the fetal position or lying straight. And honestly, for most people, this is genuinely a good default. Side sleeping keeps your airway open, which is huge. It reduces snoring, reduces sleep apnea severity, and it's the recommended position during pregnancy because it improves blood flow to the fetus. There's a reason midwives and sleep specialists both land on the same advice here. Now, within side sleeping, there's an important distinction: left side versus right side, and yes, it genuinely matters. Sleeping on your left side positions your stomach below your esophagus, which means gravity actually helps prevent acid reflux. If you've ever woken up with that burning sensation in your chest or throat, and you sleep on your right side, this is worth paying attention to. Research published in the Journal of Clinical Gastroenterology found that right-side sleeping was associated with significantly higher acid exposure in the esophagus compared to left-side sleeping. In some cases, more than twice as high. Left-side sleeping also takes pressure off your liver and may improve lymphatic drainage, since your main lymphatic duct runs along the left side of your body. The fetal position, curling your knees up toward your chest, is the most common sleep position overall. It's comforting. It feels natural. But here's the catch. If you're curled too tightly, you're compressing your diaphragm, which restricts your breathing and can reduce deep sleep quality. And over time, sleeping with your hips and knees bent all night can contribute to hip flexor tightness that carries into your waking hours. The fix is simple. Try to keep your spine relatively elongated even while on your side. A pillow between your knees reduces hip rotation and takes pressure off your lower back. Most people sleep without this and then wonder why their hips feel stiff in the morning. All right, I have to be honest with you about stomach sleeping, because this is where I see the most damage done and the most resistance to change. Stomach sleeping, or the prone position, is objectively the worst sleep position for the vast majority of adults. Full stop. I know some of you just felt personally attacked. I know it feels amazing. I know it's the only way you can fall asleep. We'll get to the why behind that in a second. But first, let's look at what it's actually doing. When you lie on your stomach, your neck has to rotate almost 90 degrees to one side so you can breathe. That's not a neutral position. That's an extreme position that you're holding for hours. Over time, this creates muscular imbalances in the neck, can cause nerve compression, and contributes to both cervicogenic headaches that originate from the neck, and chronic upper back pain. Your lower spine also takes a hit. Without a pillow under your stomach, your lumbar spine hyperextends. With a pillow, it's slightly better but still far from neutral. Physiotherapists frequently see patients with chronic lower back issues who are, without realizing it, sleeping on their stomachs every single night and undoing any progress they're making during the day. A survey-based study in BMC musculoskeletal disorders found that prone sleeping was independently associated with higher reported rates of neck and lower back pain compared to all other sleep positions, even after controlling for age, weight, and mattress type. Now, you might be thinking, but I've always slept on my stomach and I feel fine. And here's the thing, you might. Some people are genuinely less affected. But for many stomach sleepers, the discomfort has become so normalized, they've stopped noticing it. The stiff neck in the morning, the tight shoulders, that's not just getting older. That's accumulated mechanical stress from your sleeping position. So why don't people just change their sleep position if the science is this clear? This is where it gets really interesting from a psychological and neurological standpoint. Sleep position preference is largely automatic. It's set during early childhood and reinforced over thousands of nights of conditioning. By the time you're an adult, your body has built deeply entrenched associations between a specific posture and the neurological signal that says it is safe to lose consciousness now. Changing sleep position isn't just a physical adjustment. It's asking your nervous system to learn a new safety cue. And your nervous system, especially at 2 a.m. when you're half awake and rolling over, is not in the mood for new information. It's going to default to whatever feels safe and familiar. This is also connected to something called proprioception, your body's internal sense of where it is in space. Stomach sleepers often report that sleeping on their side feels like they're going to fall off the bed, even when there's plenty of room. That's not irrational. It's a calibration issue that improves over time with consistent practice. The good news is that sleep position can be changed, but it requires deliberate, patient strategy, not willpower alone. All right, this is the part that actually matters. Here's what to do with all of this. If you're a back sleeper, put a pillow under your knees, not just your head. This maintains the natural curve of your lumbar spine and prevents that hyperextension that happens when your legs lie completely flat. It's a small change, and it makes a genuinely significant difference in how your lower back feels in the morning. If you're a side sleeper, get a pillow between your knees. Your top leg should not be dropping down toward the mattress. That's what causes hip and lower back rotation overnight. Also, check your pillow height. It should fill the gap between your ear and the mattress so your neck stays neutral, not tilted up or down. If you're trying to stop stomach sleeping, start with a half transition. Lie on your side and hug a body pillow to your front. This mimics the pressure sensation stomach sleepers are used to feeling, which is often the unconscious reason the position feels so secure. Do this consistently for 2 to 3 weeks before expecting it to feel natural. The tennis ball trick. If you keep rolling onto your back or stomach during the night, despite intending to side sleep, sew a tennis ball or a firm rolled up sock into the back or front of your sleep shirt. It sounds ridiculous. It works. The mild discomfort when you roll acts as a sensory prompt before you're even fully awake. And one universal tip, your mattress matters less than you think for sleep position, but your pillow matters enormously. Most people are using the wrong pillow for their sleep position. Back sleepers need a thinner pillow. Side sleepers need a firmer, thicker pillow. Stomach sleepers, if you can't kick the habit yet, need the thinnest possible pillow, or no pillow at all, under your head, and a thin pillow under your hips to reduce lumbar extension. Look, the bottom line is this. You are spending roughly a third of your entire life in whatever position you default to at night. That is not a trivial thing. The compounded effect of consistently poor sleep posture on your spine, your airway, your cognitive health is genuinely significant over years and decades. The good news is that small, consistent changes to your sleep environment and posture add up. You don't need to overhaul your entire sleep life overnight. Start with one thing from tonight's video. The pillow between the knees, the hand position, the side switch. One thing. If you're someone who wakes up in pain, wakes up exhausted, or has just never really felt like sleep is actually restoring you, make sure to hit the subscribe button and give this video a thumbs up if this helps you out. We cover this stuff every week, and I genuinely want you to sleep better. And if you want to go deeper on sleep quality versus sleep quantity, why 8 hours can still leave you wrecked, I've got a video linked right here that breaks down the math of sleep cycles in a way that will probably change how you think about your alarm time. Seriously, go watch that next. I'll see you in the next one.